Today let's discuss about the another important blood test, cortisol test. What is cortisol test? A cortisol test measures the level of cortisol in your blood, urine or saliva to see if your levels are normal. Cortisol is a hormone that affects almost every organ and tissue in your body. It helps your body to respond to stress, reduce inflammation, regulate blood sugar and metabolism, control blood pressure. Cortisol is made by your adrenal glands, two small glands that sit above the kidneys. A gland in your brain called the pituitary gland makes a hormone that tells your adrenal glands how much cortisol to make. If your cortisol levels are too high or too low, it may mean you have a disorder of your adrenal glands, a problem with your pituitary gland, or a tumor that makes cortisol. High levels of cortisol may also happen if you take large dose of certain steroid medicine such as prednisone for a long time. And low levels of cortisol may happen if you stop the medicine suddenly. So without treatment, cortisol level are too high or too low can be very serious. What is it used for? A cortisol test used to help diagnose medical conditions that cause too much or too little cortisol. These conditions include disorder that affects the adrenal glands. Cushing syndrome is a disorder that happens when your body has too much cortisol over a long period of time. Addison disease is a condition in which your adrenal glands are damaged and can't make enough cortisol. Secondary adrenal insufficiency is a condition in which your adrenal glands don't make enough cortisol because your pituitary gland is not working properly. Cortisol testing is also used to monitor treatment for these conditions. Let's discuss the symptoms of cortisol. You may need a cortisol test if you have symptoms of a condition that affects cortisol levels. Below, symptoms of Cushing's syndrome, too much cortisol, may include weight gain, thin arms and legs, round face, increased fat around the base of the neck or between the shoulder blades, easy bruising, white purple streaks on the stomachs, breast, hips and under the arms, muscles weakness. Common symptoms of Addison's disease and adrenal insufficiency. Not enough cortisol may include long-lasting fatigue, muscle weakness, loss of appetite, weight loss, abdominal pain. Now discuss the result mean of the cortisol test. A cortisol test alone can't diagnose the cause of abnormal cortisol level. If your cortisol level is not normal, you will usually have more tests to find out what is causing the problem. First, high level of cortisol may be a sign that you have Cushing syndromes. It may be caused by taking high dose of certain steroid medicines for a long time to treat conditions such as asthma, rheumatoid arthritis and lupus. Tumor in the pituitary gland or the other parts of your body that make too much of the hormone that tells your adrenal glands to make cortisol. Tumors in the adrenal glands that make extra cortisol. Low levels of cortisol may mean you have Addison's disease or secondary adrenal insufficiency. Here is the common causes of Addison's disease include damage to the adrenal gland from conditions such as autoimmune disease or disorder, certain infection such as tuberculosis, HIV, and AIDS. Common causes of secondary adrenal insufficiency include autoimmune disease, problems with pituitary gland, traumatic brain injury. The most common cause of low cortisol level is suddenly stopping steroid medicine after using them for a long time. This is the major fault of you guys. And if your cortisol results are not normal, it does not always mean you have a medical condition that need treatment. Cortisol levels can be affected by exercise, serious illness, hot and cold temperature, certain thyroid disease, obesity, certain medicines such as a birth control pills. Remember that if you want to learn what is your test result mean, first talk to your healthcare provider, means doctor. And if you are searching for the treatment, I tell you that you don't need to take the medicine on home or the home remedies. You just wanted to talk to your doctor first. Then you will use any kind of pills, medicine, syrup, whatever he gives. But consult your doctor and don't search on the Google and the YouTube the treatment for the cortisol level. It's a very dangerous, because first you need to consult whether you are India or outside from India. A normal cortisol values in a blood sample taken at 8 am is to 5 to 25 mcg/dl, but result can vary widely depending on the time of the test and the other factors that affect cortisol levels. So consult your doctor about your result, about the units of your result, because your result can depended on the laboratory measurement, because they use different measurement, they use the different units as per the your cortisol, age factors and other history can also affect your result. Thank you very much for watching the video.